Hello, I am Dr. Chandrika HS, practicing as an obstetrician and gynecologist at Chirag Hospital, JP Nagar, second phase. See, needing hormone test, no. If you have any problem, you meet your obstetrician and she will sense, she will examine you and she will sense if there is any problem in you. So, you need not worry about the hormones. First thing is you should see that your lactation is going on smoothly. So, if your lactation is deficient also, you meet your obstetrician so that she will give you something to improve your lactation. And one more thing is, having your periods is not a must immediately after delivery, because it may take few months, sometimes years also. And what we have seen is, it depends on the nutrition of the mother also. In olden days, Indian mothers used to be always deficient in their nutrition. So because of that, because of deficiency of nutrition, they used to have a prolonged period of amenorrhea during their lactation. But what we have seen nowadays is, the mothers have become more affordable. So their nutrition is improved. And because of the improvement in the nutrition, their psychology has also improved because of the care that they get postpartum. So because of all these factors, they have started having regular periods at an earlier stage, and hence that shows that your hormone problem is not there. So if you see anything abnormal with your this thing is, that time you can meet your doctor who will know and will sense, and if it needs, then only you can take hormone test. It is not compulsory that you have to take it or you have to worry about your hormonal changes. What are all the questions that you have asked? All these things may happen if there is improper imbalance in the hormones. So when you have all these things, that is weight gain, obesity and mood changes, all those things, when you have that which is not easily controllable by your own efforts, then you have to meet your doctor, because nowadays there are very good medicines in psychiatry also, and just by a simple counseling by the psychiatrist will improve all your symptoms. So when you have any of these problems, it is better to you visit your doctor, because all these things are not good. Means what I tell is, after delivery you have to come back to your original physique as early as possible. If you come back to your original physique, most of your health problems will be solved and you will not have any problems. And not that all postpartum deliveries will have any thyroid problem. If you had some thyroid problem in your pregnancy also, there will be some low dose of thyroid substitutes that your obstetrician will be giving, and that also we tell you to do the test, that is postpartum, after 1.5 months. Then you check your thyroid hormones. If your thyroid hormones are checked and if there is all balanced, then that time you can stop the thyroid substitution that you were taking during your pregnancy. That is one thing I would advise all the postpartum ladies. Otherwise, there is no need for you to go and check your hormones like estrogen and progesterone. So, well, best time in cycle is in a female, the hormone levels varies during the whole month, because it is not the same in the early part of the month, it is not same in the middle, and it is not the same in the later part of the month. So it depends on the menstrual cycle. So if you want to do the testing, what happens is, in the early part of the menstrual cycle, it is the estrogens which is in the upper hand. Then during the ovulation, there is sudden reduction in estrogen. Then after that, there is again production of estrogen as well as progesterone. So that should happen after ovulation. And so if we want to do the hormone testing, usually we have to do during the periods, that is for second or third day of menstruation, because that is the time there is a zero effect of the other things on the body, so that you will know the baseline status of the hormones, that is estrogen and progesterone. And if you want to know ovulation, you have to do the hormone level during the 14th or 15th day, that is the time of ovulation. That is the time when the progesterone will increase if it is a ovulatory cycle, because after production of, that is occurrence of the ovulation, that is the release of the egg, the place where the egg was nested will start producing progesterone. So there is a sudden increase in the progesterone level. So that indicates indirectly that you have got ovulation. So these are the things that you have to do to know when you are going to test hormone levels during the menstrual cycle of a female. Now, hormone balance can definitely be changed due to lifestyle. See, lifestyle is one of the most important treatment that we use these days, because lifestyle changes can produce any disease. Most commonly, what we see as PCOD, that all might have heard. The disease called PCOD or polycystic ovary is all due to lifestyle only. And by changing your lifestyle, 100% there is a change in the PCOD also, and there is a definite improvement in the PCOD. So there is very much importance for lifestyle in today's life.